We often talk about obesity. It increases a person's risk of health problems, from everything from heart disease, diabetes, liver disease, and even certain cancers.
And really, as people age, the extra weight only makes you more vulnerable to some of these chronic health conditions. So a new study is revealing as women approach menopause, the change in hormones can lead to weight gain that's out of their control. And losing it, it's not easy. As Stefany Valderrama reports, there might be a solution. She spoke exclusively to an expert.
Good morning. I'm joined by perimenopause expert Sarah Gibson this morning. Sarah, thank you for joining us.
Thank you so much for having me. I appreciate it.
And Sarah, when women reach that stage of going through the changes of menopause, a new study actually just published by the Medical Journal Menopause actually shows at least 70% of women do gain weight.
Oh, absolutely. Yeah, it's one of the top symptoms that I see in women that come to my clinic.
Is losing weight at that stage typically harder for women?
Yes, typically what I see is women will come into the clinic and say, I'm eating better than I ever have previously. I'm exercising more. I'm doing all the things that I did in my 20s and 30s, and I just can't get the scale to budge.
So this study particularly found that pairing semiglutides, this weight loss drug, with hormone therapy actually makes it more effective for women who are post and premenopause to lose weight.
One of the things that I see frequently is that women will come and they're on the injectable medication and they say, I'm really not losing. Like my husband and I are both on the medication. He's losing without any difficulty, and I just can't seem to get the scale to move.
So sort of putting these medications together helps women lose weight, which as we age, typically having that extra body weight really puts us at risk for a lot of health complications.
Yeah, there's so much research coming out now about women going through menopause and perimenopause, the way that it impacts their cardiovascular health, their bone health, even elevated triglycerides and cholesterol. And I think highlighting these things just kind of bring awareness.
For anyone watching who might be experiencing this, they're having difficulty losing weight, they're going through all of the hormonal changes from, menopause. What is the first course of action? Should they talk to their doctor?
I always recommend that you talk with your medical provider first because, you can get laboratory testing done. You can see what the underlying hormone issues are. Oftentimes, weight is just a side effect of what's happening deeper in your body. So having those educated discussions and asking for help is the first step. Absolutely.
Seems like a lot of benefits, certainly something where, like you mentioned, encouraging women who this might apply to speak to their doctor. Sarah Gibson, thank you so much for your time.
Thank you so much for having me.
Steph, it's so interesting. The more we talk about semaglutides and sort of take a deep dive into them, we realize that they're benefiting, a lot of different people. So I'm sure these women are feeling a lot of relief knowing they can combine these to help lose weight. But I'm curious, did she say anything about, the hormonal therapy on its own and maybe the benefits that even just that can have for women?
Yeah, so I did read through the study, and one of the things typically, when women are going through menopause, they have difficulty sleeping, the hot flashes that we all know of, even low energy. And with the hormone therapy, it also helped with that. So that was a much needed relief, again, for the women that were part of the study. But like she said, we want to encourage women to talk to their doctors because there are so many benefits to both when you're going through those challenges and also the weight loss that will eventually help you on down the road.
Yeah, every woman, everybody's body is different. So also very important to talk to your doctor for that reason.
Absolutely.
All right, a lot of important information. Steph, thank you. Stick with us here on ARC Florida. We'll be back right after this. Hi, I'm Sam Kerrigan for CBS 12 News. Click the like and subscribe buttons if you want to see more stories like this that impact you.